and chronic pain. So that would be right in the ballpark with what you're thinking about, I think.
Yeah, that'd be great.
So we'll do that next Friday. And just for everybody else to know that we have an Instagram live every Thursday at noon, and it's a Q&A time where you can ask questions to me and one of our other doctors, Dr. Maria Marian, who presented the very first time with me to you. Anyhow, it's at noon on my Instagram, which is dr.darvish.nd. If any of you would like to join and bring me some questions, I would be ecstatic. It will get the conversation going. So, Monica, you good? We should start?
Yeah, so I'd say go ahead and start.
Okay, so let me go ahead and share my screen. This is a PowerPoint presentation that was put together by Dr. Marella and Dr. Peru. Let's see. Can you guys see this? It's the front, the main page where it says Holistique Gut-Brain Access?
Yes.
Okay, I just want to make sure this is working because it sounded like last time or a couple of times ago it didn't work. So I'm going to start the presentation for them, and they will pop in and hopefully finish it off. We'll see how it goes. So one of the first things I want to actually just make sure that we all know is that any advice or anything that we talk about today should not be taken as any kind of an advice, and that everyone should seek their own medical professional. Anything we discuss should not be also taken as a claim on any kind of diagnosis, treatment, cure for anything. So just wanted to put that disclaimer out. Just so that we don't get into trouble with the higher powers above us. So this is Dr. Marella, which you met last week. So she will be coming in to join hopefully soon, as they're dealing with an emergency patient currently. So she'll pop in and continue the presentation. She's a naturopathic doctor as well as a licensed acupuncture doctor, and her specialties are in chronic disease, women's health, GI disorders, and physical medicine, sports medicine, and IV therapy. She's just finishing up her second-year residency with me, so she'll be joining us as an associate in just a few months, officially. Dr. Peru has just joined us in the last 8-9 months. She's been in practice for almost 19 years. And her focus is chronic disease and biotherapeutic drainage, detoxification, lifestyle medicine, and primary care. So she's also a wonderful doctor to connect with. By the way, if anybody wants to mention any questions they have or comments, please either send the chat box or I think that would be the easiest actually, because I can't see the screen with the hand. But if you want to send me a chat, then I can respond. So please do interrupt me. I'll be more than happy to respond as soon as I see it. So they created this glossary of terms. The microbiome basically is the family of bacteria, viruses, molds, and yeast that are within us. There's over 1 trillion cells of these guys, more than what human cells are. So a lot of the regulation that you see in our body, whether it's hormone production, nutrient production, digestive enzyme and assimilation of foods, whether it's mood, mind, well-being, disease, a lot of it can be controlled by the microbiome that we have in our gut. And they're seeing that there's a microbiome that is a completely different family of bugs in our brain, that we have it on our skin. We have it in every part of our system. And it's a very interesting thought to think about the microbiome when it comes to relationships, because when you think about meeting somebody, and let's say you're carrying the herpes virus and they're carrying the herpes virus. Is it a law of attraction between the viruses, or is it actually our cells? Because there's trillions of these microbiome or these bugs that are within us. So who is getting attracted to who? That's a big question that I've been curious about, and I hope research answers that sometime soon. The blood-brain barrier that we'll be also mentioning is the area of the brain that is really basically the barrier between the blood, between basically what's outside coming into our blood system and then connecting with the brain. So there is a barrier that was discovered decades ago that is a very fine barrier, and it can get damaged, just like the gut lining can get damaged, which can allow for exchange of nutrients, but also toxins to enter into the brain. And that's sometimes what happens when we eat something and we get a brain fog or have trouble focusing. It's that it's actually coming from the toxins from our gut that is going into the blood, and then the blood-brain barrier is not intact enough to say, you stay out. Instead, it's allowing that those toxins to enter the brain. And that's what causes the fogginess and the headaches perhaps, or the lack of focus or lack of attention, or what have you. So it is something that is very important, and we'll talk about that in just a few minutes a little bit more. Dysbiosis is a term that was coined decades ago, but it's becoming more mainstream term, which basically means there is an imbalance between the good and the bad bacteria, that the microbiome is not behaving the way it should. And so there is certain bacteria balance that we like in the gut, for instance, and when there is an imbalance going on in the bacteria, or there's overgrowth of yeast, or there's an overgrowth of some bacteria like Klebsiella or C. difficile, or whatever it is, that's what we call dysbiosis. And that dysbiosis can also impact our well-being, our health, and the way the gut functions, the way our hormones are produced, and the toxins that get into the blood and into the rest of our system. Anybody have any questions so far? No, you're all good? Okay, so mental disorders. Mental disorders such as depression, bipolar, schizophrenia are actually the top causes of disability in the world. Oh, there is Dr. Peru coming on board. I just finished talking about the, hi Doc.
Hi.
Hi, there's Dr. Marella, hi. I was just entering this page, just finished talking about the terms. So if you guys wanna take on from this page, that'll be perfect.
Okay, sure. Hi everyone, I'm Dr. Marella. I'm so sorry that we're late. There was a little bit of a, well, clinic happens, you know. But okay, let me take it on from here. So as you guys know, mental disorders such as major depression, bipolar, and schizophrenia are one of the top causes of disability worldwide. And I just wanted to suffice this presentation and just say, that we're not trained mental health care providers. I'm not too sure about whether you guys know what we are trained in, but we are trained in holistic primary care, or as holistic physicians. So we get a lot of training on botanical medicine, physical medicine, IV therapy, diet and lifestyle, homeopathy, and we do get a lot of training on some counseling techniques. And there's many different ways that we approach mental health. But today I wanted to focus more on talking about how the microbiome can affect the mental health and your mood. Oh, Dr. Darvish, do you think you could press the next button? Next slide. Thank you. Okay, so the human microbiome. So I'm sure Dr. Darvish has already talked to you about this, but the microbiome is essentially the collection of bacteria and fungi and yeast that could be in your gut, and they help with defending us from disease. It helps us digest our food, helps us metabolize the nutrients, and it helps us maintain the mucosal barrier, and specifically the intestinal barrier and the blood-brain barrier. And it also prevents us from getting chronic diseases. And so there's about 500 to 1,000 species of bacteria. Everybody's flora is different. It's individualized and it's unique to you. We all have the same phylum or species of bacteria, but the concentration or the levels in which they are present in our flora are different. And the microbiome can be influenced by our diet, our age, our genetics, environmental toxins, birth circumstances, toxins, hormones, medication, stress, and stimuli. And I want you guys to remember the point here about the maintenance of the mucosal barrier, because research does talk about when there is an imbalance in our microbiome, that our intestinal and our blood-brain barrier do get leaky. And I'll talk about that in the next slide.
Can I just expand on that just a little bit? On the birth circumstances, it's interesting because they find that when there is a C-section delivery versus a vaginal delivery, that the C-section babies don't have the composition of the healthier microbiome or bacteria that creates health. And hence, a lot of C-section babies do get more problems throughout their childhood in terms of eczema and allergies and asthmas and things like that. So, the hospitals tend to want to just do C-sections. And as birthing mothers, we really have to encourage them to push a little bit and do delivery if possible. So just something to keep in mind. It's a fascinating subject on the health and well-being of individuals in their lifespan from the time of birth and the method of delivery.
So this study particularly talks about what we just talked about, when there is an imbalance in our microbiota or microbiome, that it does affect the blood-brain barrier. And in this research study, they compared two different groups and they experimented on mice. So one group of mice, they had parasites in their gut, and then the other one essentially had a normal or healthy flora. And they found that the group that had parasites in their gut actually had a leaky blood-brain barrier. And actually, which is really cool, once they resolved the parasites and inoculated them with normal or healthy flora, that the blood-brain barrier actually fixed itself and it wasn't as leaky anymore. So what does this mean? This means that when our microbiota is off, our blood-brain barrier can be leaky, and that means that it's susceptible to getting attacked by different toxins. So whether that's inflammation markers, whether that's metals, whether that's bugs or parasites, and obviously if your brain is getting attacked, then it makes sense that that would affect our cognitive function, our mood, and may cause anxiety and depression. And in fact, this study talks about that, about how the gut microbiota can affect mood. So this research study talks about, or it studies two different groups again. They're veterans, so veterans who've been diagnosed with PTSD, and the other group was veterans that were not diagnosed with PTSD. And they found that the veterans who had PTSD had a decrease in diversity in their microbiome, And that just means they didn't have as many species of bacteria in their microbiome. And they actually found that there was an increased concentration or level of certain bacteria that are associated with decreased cognitive function.
So we just have a little quick chat to intervene here, Doc. They say there is a tribe in South America that has parasites in their guts and their health is great. So that's a very, or in their heart, and their heart health is great. So that's a very interesting effect, because they also have seen that when you sterilize the gut, or if you sterilize mice, where there is actually no bacteria at all, no parasites, nothing, that those mice have a much shorter lifespan and they die very quickly of illness. Whereas the mice that have a lot of different bacteria, they also have better health. And so it's interesting to look at the different bug compositions versus no bug composition at all, and see what the overall well-being is like.
His comment back to that is they also walk 30 kilometers a day, so inconclusive. So maybe it's the exercise that's helping them, who knows? Okay, next slide, please. Okay, so I want us to remember this figure that I showed you guys last week. And if you were not there, I'll go ahead and describe it again. But essentially, there are two parts of our nervous system. So our parasympathetic and our sympathetic nervous system. So our parasympathetic is our rest and digest. This is essentially where we want our nervous system to be when we're eating. We want it to be relaxed so that we can eat and digest correctly. But when we are in this state of chronic stress, and maybe that's an internal or a physical or emotional stress, we're in this sympathetic fight or flight mode, which again, the common analogy that is used for the sympathetic nervous system is running from a bear. So when we're in this fight or flight state, all of the blood is going towards our periphery, so to our arms, to our legs, so that we can run from the bear. And there's little blood going into the abdomen area, so in our intestines or towards our stomach, and that causes a decrease in digestive function. And that means that there will be a decrease in absorption of the nutrients that we're eating, and I want you, and specifically amino acids, other nutrients as well, but I want us to just focus on amino acids, because amino acids are the derivatives of our neurotransmitters. So they are what make up our neurotransmitters.
Just a side note on this too, the hydrochloric acid that we hear a lot about, the stomach acidity, is really important in breaking down and absorbing these amino acids. And so when you are in a state of fight and flight and stress, you're actually shutting down the hydrochloric acid as part of the digestive juices. And hence, majority of people who are under a lot of stress chronically have low hydrochloric acid, and therefore they're going to have less absorption of the amino acids and nutrients from their guts.
Mm-hmm. So what are our neurotransmitters? So like I just said, our neurotransmitters are derived specifically from amino acids, which are from protein sources. And our common neurotransmitters are serotonin, dopamine, norepinephrine, epinephrine, GABA, and glutamate. And I put some notes there as to where those neurotransmitters are derived from. And I'm going to go in specific as to what these neurotransmitters, what they do, and what their function is.
There's also another chat coming in. It says, so all of our doctors who prescribe acid suppressors are wrong, are they not? It's a good possibility that there are better ways of addressing heartburn and gastritis than doing acid suppressors, because as you do acid suppression medication, then you are not only reducing the hydrochloric acid and the absorption of these amino acids and proteins, but then you are also putting a lot more stress on the lower gut, the colon and the intestines, to do the work that the stomach didn't do. And as a result, we get a lot more inflammation in that gut, in the lower intestine, and hence there is so much increased risk of colon cancer and other gut-related cancers in this culture because of the way we're dealing with the upper stomach acid issue. Just wanted to put that in there to answer that.
So first one, serotonin. So serotonin functions in our mood control, our sleep, pain, GI motility, and their levels can be associated with depression, and low levels can actually affect appetites. In that you're not as hungry. And it is synthesized in the gut. And they do find that when the gut microbiome is off, that those serotonin levels are actually lower. Next slide, please. The next one is dopamine. Dopamine enhances our reward response. It stimulates our pleasure center. So this is actually what spikes when we get a text message. This is why we get addicted to our phones, certain maybe drugs. It's just because, you know, we are getting a rush of dopamine and we feel good. It's stimulating our pleasure center and we just can't wait for the next text message. It also helps with sleep, our mood swings, depression, anxiety, lack of motivation, our libido, and attention and learning. The next ones I'm going to talk about are just norepinephrine and epinephrine. These are responsible for regulating our sympathetic nervous system. So remember, we're running from a bear. So obviously these are going to help with regulating our heart rate and blood pressure. So when these are high, our heart rate's going to go up, and we're running from the bear. It's also going to regulate our glucose so that we have enough energy to run from this bear. So in this slide, I know it's very busy. I tried really hard to make somewhat of a digestible image of how the gut talks to the brain and how chronic stress affects our gut. So I'm just going to preface this this part with just bear with me. I'll try and go slow. You can't see my mouse. Okay, well, I'll just try and be really, really descriptive. Okay, so we're gonna start on the bottom left. So in the bottom left there, we're in our intestines and our digestive tracts. And within that is our gut microbiome or gut microbiota. And let's just remember that when this is off, when our microbiome is imbalanced, we get leaky gut and we get a leaky blood-brain barrier. And what that means is now the cells in the intestines now have bigger gaps. And so bigger molecules, parasites, bacteria, inflammatory markers can now go through those junctions. We call them tight junctions, and they go through those junctions and into the systemic blood system. And so as you can see, when you move up from the gut microbiota, you see that there's microbial antigens, which are just bacteria, and then cytokines and prostaglandins. Those are inflammatory markers. They circulate in the blood. And then remember, our blood-brain barrier is leaky because our microbiome is off. And so now all of these things can enter through the blood-brain barrier and into our brain. And this can affect our cognitive function, our mood, can cause anxiety and depression. Another way that the gut can talk to the brain is, so the gut, we're here on the bottom left corner. So the intestines is innervated or controlled by our enteric nervous system. And what that means is that it acts separate from our spinal cord and our brain, which I think is super cool. It kind of just reacts on its own. But the way that it is connected to the brain is through the vagus nerve, and actually it's bi-directional. So the brain can talk to the gut via the vagus nerve, and the intestines can talk to the brain via the vagus nerve. So any stress that the intestines is experiencing can stress the brain, and then the brain receives that stress and then reacts. And it can react in many different ways. And this is where we're getting into the polyvagal theory, which is pretty complicated. We could probably do another slideshow on that. But essentially what it is it's activating one branch, which is through the sympathetic nervous system, and causing us what they call in the polyvagal theory is mobilization, which I like to think of as running from the bear. So the cortisol, the norepinephrine, the epinephrine is increased. We're mobilizing, we're moving, we're feeling a little more anxious. Another way that the gut can be affected is through stress. So here we're on the very top right of the figure. So when we're in a state of chronic stress, whether that's emotional, whether that's physical, the stress will trigger the brain, and it goes through what we call the HPA axis. So the hypothalamus, the pituitary, and the adrenal glands. So the brain basically talks to the pituitary gland, and then it talks to the adrenal gland, which is essentially what I like to think of as our stress organ. And then the adrenal gland makes more cortisol and more norepinephrine and more epinephrine in states of chronic stress. So now we're like feeling pretty anxious. And then another thing that I found out, last one that I found out while I was making this slideshow, is that actually the intestines, there's a part in the intestines called the ileum that makes cortisol or corticosterone. And they find that when the microbiota is off, that there is an increased production of cortisol in the intestines. And so we're getting a lot of cortisol from, our stress from the HPA axis, and then we're getting additional cortisol from our intestines. Do you have anything to add, Dr. D or Dr. Paru?
So I was, thank you so much. That was fantastic. So I was also going to just focus on the positive aspect of this, is that what you're thinking, the positive thoughts that we have, the quality of thoughts that we have can also impact your gut. And hence it can impact creating an anti-inflammatory cytokines and prostaglandins. So these proteins that are produced are not always inflammatory. They can be anti-inflammatory. So as you're creating positive thoughts, you are changing your microbiota. You're changing the bacteria balance in your gut. And that can affect the inflammation in your whole system and the way you're thinking, your mood, and all of that. And then also when it comes to stress, if depending on how you're seeing stress, if you can really see it in a much more positive, empowering way of dealing with that stress, then you're going to reduce the stress response that's coming from the adrenals, that cortisol. And the reason Dr. Marella was mentioning the cortisol as being a big deal is because cortisol, though it is a stress hormone that keeps us fighting and getting out of the situation, cortisol is very much a catabolic hormone, which means that it breaks down tissue. So when you're under stress, it's really hard to hold muscle mass. It's really hard to keep your ligaments intact. And hence, when people are under stress and they're stressing more with intensive exercises, that they're more prone to injury and hurting themselves or having tendinitis or something in the musculoskeletal system. So that's just an example of why cortisol is important and why it's so important for us to continuously feed our brain good stuff so that it changes the microbiota, but at the same time feed the microbiota so it impacts the brain.
So these are signs and symptoms of altered neurotransmitters. So I put this here because now that you understand how the gut talks to the brain and how stress impacts our gut, now you can see why these signs and symptoms come up. So it's altered sleep, decreased concentration, fatigue, irritable bowel syndrome, altered mental clarity, pain, sweating, dizziness, heart palpitation, attention deficits, addiction, and diminished energy and motivation. And I do want to add that there is research, and I didn't include this on here, but there is research with ADHD, with children who have ADHD, that they do have an imbalance in their microbiome, and that there is some research going on that once they fix that, that their attention is able to, that their attention improves. So in conclusion, the human microbiome can alter our neurotransmitters, and it does affect our mood via the gut-brain axis. And now you guys all understand that. So now you can make this, this lecture. Next slide. But it's not just about neurotransmitters. So neurotransmitters can affect our mood, but one other thing, what about our hormones? So estrogen is mainly processed in the gut. There's other spots too, like the liver, but the gut is a site that it does get processed in, and it's specifically done by an enzyme called beta-glucuronidase. And research has shown that elevated levels of this enzyme, beta-glucuronidase, indicates dysbiosis and problems with processing your estrogen. So that means that when your gut microbiome is off, there is risk that you're not processing your estrogens as well, which means that your estrogens are going to be high. And that's what us naturopaths call estrogen dominance. And all of us ladies know what estrogen dominance feels like, because Miss Flo comes knocking on our door every month and she says hello, and we start feeling breast tenderness, moodiness, irritability, cramps, back pain, maybe some diarrhea or constipation. So as you can see, you know, if our microbiome is off, it'll affect our estrogen or our hormone levels, and thus also affect our mood. Do you have anything to add about that, Dr. Darvish, since you do a lot of hormone therapy?
I think this is a huge conversation, so we'll probably do a full Zoom lecture on just this, hormones and stress and what we can do.
Yeah.
Thank you.
So now we'll get into naturopathic approaches. So I'll give the mic to Dr. Peru.
Hold on.
I can hear you now.
Oh, okay. Here I am. So to sort of put a summary on what Dr. Marella has been talking about is that everything is interrelated. And I think that we have the tendency in Western culture to compartmentalize and say our mental, emotional well-being or our health is separate from our physical health. And that is not the case at all. In that, as she explained, there's this crosstalk between our digestive system and our brain. And the gut is actually considered to be a second brain or a little brain because of how much nervous intervention there is. And so as naturopathic doctors, we really like to look at things holistically and consider all the aspects that could be affecting mental, emotional health, be it coming from our physical, coming from a physical imbalance. And we have a lot of tools in our arsenal to determine that, and it's always helpful to have some type of objective finding. You know, we spend a lot of time with our patients just in the visit, talking with you about what your symptoms are, but having some type of objective measurement is helpful to add more pieces to the puzzle. So we do a fair amount of comprehensive blood work, which is, you know, you probably are all familiar with the blood tests that we do. There are some nuances to that, but more specifically, we have a stool test that we do, which is looking at the health of your large intestine. And it will specifically tell us what kind of shape your microbiome is in. Is there imbalances? Do you have not enough good flora? Do you have bad bacteria that we don't want there? Are there parasites there? And then how are you breaking your food down? How are you absorbing your food? Is there inflammatory markers? What kind of amount of leaky gut is there? So we can assess that all by doing this stool test, which again just kind of adds more information and informs our treatment plan. The Dutch test is a hormone test. It's a urine test, and we put this on here because of the last slide about talking about hormones and that how much so many of them are created in the digestive system and are metabolized in the digestive system. And so by using this test, we get a good sense of what's happening with your estrogen and your progesterone and your testosterone and your DHEA, all these hormones that are coming out of different places in your body. It also actually has and gives us an indication of what your neurotransmitter health is like indirectly, because it tests for some of those parameters as well. Okay, next slide. So, being naturopathic doctors, we have to start with the gut because that is the root of so many chronic ailments. And diet is huge in its influence of our microbiota. And, we can talk about fermented foods, which not all fermented foods are giving us good bacteria, but a lot of fermented foods do. And then there's fiber that is food for your microbiota. And then there's prebiotics, which again are a type of food for your bacteria in your gut. We often recommend avoiding food intolerances. And this is because if we're causing more inflammation in your digestive tract, it's kind of this vicious cycle where you eat a food that is problematic for you, it's going to cause inflammation, it's going to cause more of a leaky gut, bigger proteins are going to get through to the bloodstream, and it's going to thereby it's going to have a systemic effect. And so again, there's that connection between your gut and your brain and that crosstalk that happens. Apple cider vinegar is actually a source of probiotic. If you get the apple cider vinegar with the mother, that stuff that's floating around, I'm sure that you've seen that in the bottle. But I use this treatment very effectively for folks that have a problem with digesting their food. And so it actually has two uses clinically that I've found. If people are suffering from heartburn and reflux, I use this very successfully to calm that symptom. And you think, oh, vinegar, this must be acidic, but it actually has an alkalinizing effect on the system. And then the other use that I use it for is as a digestive stimulant. So I have people take a certain amount before they eat, and even thinking about the apple cider vinegar or thinking about, hey, I'm going to get my food soon, starts this cascade of your body putting out digestive enzymes and the appropriate hydrochloric acid to help break your food down. We put down exercise and massage on here because of the effect that it has on your neurotransmitters, specifically dopamine, which is that reward neurotransmitter. That exercise and massage therapy have a very good effect of increasing your dopamine. Next slide.
I'll add to that, Dr. Peru, is that too much exercise can actually have a counter effect on the microbiome in the gut as well. So when runners get this thing called the runner's diarrhea, it's because of the impact of the stress hormones from exercise that it's having on the gut microbiome and causing this motility issue. It's very interesting.
So there are a variety of supplements that can help with gut integrity, lowering inflammation in the gut, improving digestion. And again, the whole goal with this, for the purpose of this lecture, is trying to improve your digestive function because it can influence what's happening with your mental, emotional health. So probiotics, I'm sure that most people are familiar with. It's a pretty hot topic, is taking a external source of good bacteria. Prebiotics are the food for the bacteria, which you can get from food sources, definitely. So things like Jerusalem artichoke and chicory, and they're just basically carbohydrates that your body can't break down, but the bacteria in your large intestine, it's food for those bacteria. And then glutamine, which is an amino acid, which is food for the cells that line your intestine. And then the omega-3s and the rest of these are, well, the olive oil and the zinc and the A and the D are all helpful for inflammation. And again, it's the omega-3s are helpful for your cognition and your brain health. Digestive enzymes and hydrochloric acid, Dr. Darvish spoke about a few slides back about when you're under stress, the physiologically your body shunts blood away from your digestive system to your extremities to allow the person to get away from the stress, and thereby compromising your digestive function. So sometimes we supplement with digestive enzymes and hydrochloric acid in order to support the system while we work on the deeper issues of trying to help the person manage what the stressors are. We showed this slide last time as far as the botanical or the plant medicine that we commonly use. The adaptogens, again, are plants that have a balancing effect. So if something is too stimulated, we can take the plant and it will calm the system down. And if it's understimulated, we can take the plant and it will be supportive and stimulating. And this is more from the mental emotional aspect of trying to provide plants and herbal medicine that can have a balancing and calming effect on the nervous system. And those are what the nervines are, which again is calming to the nervous system. But really it's about trying to find that balance and using those symptomatically, because everybody, often people need some type of intervention that will kind of get them, over the hump as far as how they're feeling, if they're overly anxious or depressed or what have you. But again, we're always trying to dig deeper to figure out the root cause of where the imbalance is. And then bitters is helpful. Bitter herbs are helpful for stimulating your digestive system. And again, stimulating your digestive system is only going to improve digestive function, thereby improving your microbiota and therefore improving the crosstalk with your brain. Oh, yeah, I guess we've reached the end of it. Dr. Marella, are you there? I think she's...
I put myself on mute and I forgot I put myself on mute. Okay, well, we just want to thank you guys for your attention and your time. We really enjoy doing these. It's really a good opportunity for us to review all the things that we learned in naturopathic medical school. And it's fun really to share what we love with you guys. So now, do you guys have any questions for us? I can read them. So